We look at the aspect of protein, energy, malnutrition. So for protein, energy, malnutrition, we try to go around this topic and make a lot of sense in it. So, just have to do it. The child is being malnourished, you know, it's not taking, you know, good amount of proteins. Could be that it's taking, but there's no absorption. You understand? So it's also called protein energy undernutrition. It's a serious condition caused by inadequate intake of proteins and calories. Do you understand? So it's a spectrum of disorders and it's primarily due to what? You're not taking a lot of proteins and energy foods. So we have different forms. We have Kwashiorkor. You can see Kwashiorkor. You can see Marasmus. You can pause to observe their characteristics. So Kwashiorkor is a severe calorie and protein deficiency. There's wasting of muscles and fat. You understand? And that's Marasmus, right? Kwashiorkor is severe protein deficiency with relative calorie intake. So Marasmus is both protein and calorie, while Kwashiorkor is what? Just you know proteins, but you're taking calories. Then we also have Marasmic-Kwashiorkor, which is like combination of both. So causes a lot of deaths, okay, worldwide. About 250 deaths in children worldwide yearly is due to this protein energy malnutrition. So that I think we should talk about it. Okay, we just spoke about the symptoms. Okay, we have risk factors. Very nice. The risk factors are very important. So the symptoms include the child is so thin, visible bones, loss of fat and muscles, growth retardation, irritability, the person is hungry. That's for Marasmus. For Kwashiorkor, there's swelling, so edema, pot belly, enlarged liver, brittle bones, discolored hair, skin lesions. Person is weak, impaired immunity, any infection can just get to you, frequent infections, poor wound healing. Yeah. So causes and risk factors is the person is not taking good amount of food because of poverty or famine or early weaning. You switch the child from breast milk to normal food too early. You have some disease condition that are impairing the digestion. That's why I was telling you guys that the person can be taking, but sometimes the digestion has an issue. Chronic disease, cancer, renal failure. Okay, so children in food insecure households, elderly in the hospitals or nursing homes, patients with chronic illness or wasting disorders. So you diagnose it from almost just seeing the signs and symptoms here. Then I could also send the lab stuffs, for diagnosis to check for the balancing of all those electrolytes and look for weight for height, mid upper arm circumference, all of that. So treatment is immediate care, so correct the fluids and electrolytes, gradual refeeding with balanced proteins, oral feeding, you know, intravenous fluid or tube feeding if necessary. Then treat any other underlying disease condition that the person have. Is it infections? Is it anemia? You do transfusion and all of that. Okay. Address food insecurity. If there's a war, you need to stop that war. Maternal nutrition, public health measures, educate people.